Welcome back, everyone. We're about to begin our afternoon program here in Minnesota, but to those who've just joined us and those who've been with us all morning, we're so glad you're here with us on this special day. I wanted to remind everyone who wanted to make use of the American Sign Language and closed captioning, there is accessible programming. The information is on the box, the description box on the YouTube channel that you're watching. I want to thank St. Cloud State University for providing this service, but also for inspiring us and being our treasured partner on deepening and expanding our accessibility here at Global Minnesota. So thank you so much to St. Cloud State for that. The next part of our program, we're going to be looking very deeply at how one of our main healthcare providing and medical device companies, Medtronic, is partnering and partners with the community to find those special ways to address critical issues that relate to our theme today, health equity and equality. To kick off this afternoon, we're going to first hear from the President of the Medtronic Foundation and Vice President for Philanthropy, Paurvi Bhatt, in the foundation role. I first met Paurvi when the company Medtronic became clearly one of the true leaders in our nation and around the world on the Sustainable Development Goals. And beyond just sort of how that affects them and how they make their decisions, they were the strong voice saying that Sustainable Development Goals need to be generalized and socialized throughout our companies. They created an organization with others called Impact 2030 to provide a vehicle for involving the employees, the team members from companies everywhere in achieving those important goals. And so I'm really pleased to have Paurvi leading our session coming up right now. Also joining us is the Chief Executive Officer and Chairman of the Board of Medtronic, Geoff, who is the leader of one of the world's largest and the world's innovative leader in medical technology. Some of you earlier heard me mention Earl Bakken, who was the founder, co-founder and creator of one of the earliest products. My life has been changed when I heard his message about not just the importance of innovation in medical device and medical care, but asking the ethical questions about what do we do with the extra years of life that we've been gifted through modern medical technology, but also through things like heart transplants, pacemakers, heart valves. These are things that we're very proud of in Minnesota, that we've been able to be the home for innovation for so many of these things, heart valves, et cetera. But we're also proud that we're part of the thinking, the intellectual, the ethical, the thought leadership about what are the issues that come out of these kinds of opportunities being presented. And of course, this COVID-19 pandemic is an opportunity for changing and thinking, but it's also a great challenge to us all. So I'm so thrilled to have this opportunity to hear from Medtronic about special partnerships that they're making. And Paurvi, please take the mic and welcome to all of your team. We're so excited to hear this new partnership that Medtronic will be talking about over our noon hour.
Well, thank you, Mark. And it's just terrific to be here today. It's World Health Day, and that is a cherished day for so many of us. But this particular topic really comes home for us because, of course, equity is so central to all of our thinking. It always has been, but I think none of us can look away from what's happened over the last 18 months. And just so proud of what we've been able to achieve together, and just in the humility of exploring how do we think about equity in these times. And just love that you hearken back to Earl Bakken and even the really important call to action of what do we do with our extra life. I think the partnership that we're coming into, and you're going to hear a lot about today, really brings that to life. So just excited for this time in front of us, and couldn't be even more excited to be here with Geoff. We've had some time to do this in a few rounds, and to do this at home in Minnesota, and to really talk about the importance of global issues for us right here in Minnesota, and the important role that companies and nonprofits and just the Minnesota perspective offers when we bring what we have to solve some of the largest global problems that the world is facing. And the whole day has been focused on that. So, Geoff, it's great to have you here, and would love to kick off and just talk about personally, what does health equity mean to you, and why have we really come into this so deeply as Medtronic?
Sure. Well, thanks, Paurvi, and thanks, Mark. Thanks for the introduction, and I'm really excited to be here today on Global Health Day and talking about a topic that you'll see that is something that near and dear to our heart as a company and me personally, and very passionate about. So I'll just kick it off then. Your question was about health equity. What does it mean?
Yeah, and to you personally, and then certainly as it's woven into our mission.
Well, sure. I mean, like you mentioned, I would start there with Medtronic's mission, which, for those that aren't familiar with it, was written. Mark mentioned Earl Bach, and our founder. He and a few others on his team wrote the mission 60 years ago, and it hasn't changed. And there's multiple tenets of it, but it does talk to. There's actually 6 tenets, but a number of those tenets get to things like improving patient outcomes, but for all patients and around the world. And so this whole idea of healthcare outcomes for everybody, whether you live in the United States or in other parts of the world, is something that Medtronic's been focused on for a long time. And so, so for us, this is something that is very important. And the opportunity, we feel we're in a good spot to help out with health equity here. I mean, it's in an age of innovation, the technology innovation that's taking place right now inside of healthcare and outside of healthcare, but we bring that technology into healthcare, is really making it possible for us to address what we call the universal healthcare needs simultaneously, improving outcomes, but at the same time of lowering cost and improving access. And all the improvements in technology that have really accelerated put us in a position to do that. And technology is having a meaningful difference, including driving healthcare to underserved areas. With heretofore it's been difficult to have meaningful healthcare outcomes in those areas. And so that's a big driver of it. And so we're a technology company in healthcare. We think we can use that technology to help, but there's broader. We do have to work with governments around the world to help this. We have to work with different partners, like we're going to talk about some of those today, because we're not a healthcare delivery company per se. We're more of a technology company. We've got to work on, beyond technology, new systems of care, moving from we're in a volume-based healthcare environment in the United States to more of a value-based one. Mm-hmm. But ultimately keep the eye on the prize here, which is those outcomes. And driving that access. So everything we do is not just technology for technology's sake, but driving outcomes and for all people. And so we've had to make, and Paurvi, you've been a big part of this, we've had to make a very specific focus on some of these underserved areas around the world, because actually providing meaningful healthcare outcomes in these underserved communities where the resources just aren't there is something that is very challenging. And we determined a few years ago that it's going to take a very specific group of dedicated resources and investments on our part to really get there. You can't just take our products that we use take the United States. And even if we gave away, like Omar used to tell the story, even if we gave away pacemakers in India, that's not enough because they don't have the infrastructure. So we've got to do more in these under-resourced environments.
Well, and that challenge that we've taken on has rapidly become a very global and boundaryless one. Those challenges are happening right here in the United States just as much in different ways as around the world. The underserved is everywhere, and that has been such an anchor point around universal health coverage and even this SDG discussion that's afoot, which is for every country, every location. And so, as we've been perseverating on this, I think there's so much that happened during COVID. Where we really dialed up, what's our role when there's something that happens that really shocks the globe. And it's been a big thread of the conversation this morning. And so it'd be remiss if we didn't take a little time here to just walk through, how did our perspective on addressing a global problem and living out that mission that said everyone deserves something in this time, what can we do? Our work with the ventilators and just stepping in that we did with COVID, Geoff, would be great.
Yeah, I think COVID really did, to you, as you've intimated here, really did remind us of the role that we could and should play, and to think big here. And in this case, for us, there was a number of things we did during COVID. One that gets a lot of attention is our role in ventilators. So if you rewind the tape back to the spring of 2020, when COVID was really taking off, there was a lot of unknowns. Hospitalizations were on the rise, and hospitals didn't know how to treat COVID patients very well. They've gotten a lot better at this. Put aside the vaccine, this is treating people that are sick with COVID, and ventilators were considered to be, and still are, considered to be a huge part of the treatment protocol. And there just wasn't enough ventilators out there. And they didn't have the right functionality to accommodate these patients. And hospitals wanted remote capabilities, how do you operate the ventilators remotely, monitor patients remotely on ventilators versus having to go in the room. And there just weren't enough of them. And we at Medtronic, we provide a third of the critical care ventilators in the United States and over a quarter around the world. And so we were, in a position where, one, we needed to dramatically increase production. We needed to improve and enhance the capabilities of these ventilators. And in addition to that, we had to take on a primary role of allocating these ventilators around the world, and that had to be done in a very needs-based way. It can't be. We took the approach. It couldn't be, who pays you the most or your strategic partners. It had to be based needs-based. And so we, in many ways, changed. Really had to come up with some new things. We're not normally put in a position where we're allocating things like that. And we didn't get much guidance from governments. And matter of fact, they were conflicting. Everybody wanted ventilate. They wanted to save lives, but lives of their constituents. And we're a global company. So navigating all these things, our mission really helped guide us. We knew this was a moment in history that will always be remembered. And I'm proud of the way we stepped up. We were able to increase ventilator production 5x, 5 times in a very short period of time, and kind of how we did that with partnerships and open sourcing the ventilators. So we put our plans online so everybody could see them and download them. And we had people coming from all over the world, different industries, helping us with solutions to ramp production and to improve the functionality of it. And then we work directly with governments all around the world to help allocate these ventilators in the best way possible and navigate the politics, because we didn't want to get involved with that, and keep the patients first. So it really reminded us of the role that we can play on a global scale and the impact, and really proud of how we handled that.
Well, and that segues so well into really putting a real life frame on what we mean when we say social impact. Really bringing the full power of everything that the company can do to address some of these pressing issues. And in addition to everything that was happening from the company, there were certainly things that were happening philanthropically, and the whole envelope of what we did together really certainly lived out our mission, but also put us on the map. And I couldn't be more proud to have done that together. And I think we're on the brink of that today in the announcement that we're going to be making and the partnership that we have with Children's HeartLink. As you're thinking about social impact and social outcomes and reflecting on our foundation, you sit on our board as well. What kinds of things do you see are transformational in the way that charitable foundations can behave in this time? Really getting outside that check writing mindset and thinking more about social outcomes.
Well, like I said earlier, Medtronic, we're a technology company and we're not a healthcare provider. But ultimately, so we're not a hospital. We work with hospitals obviously and enable them. But ultimately, we're in it for the outcomes, and so partnering with these organizations to help is what we do. And the foundation provided us a unique way to create partnerships that went beyond our technology in some cases to help. And during the pandemic and the social unrest issues that popped up. And so I think a couple of things that come to mind over the last year, both the pandemic and the social unrest, is our ability in the foundation to do a couple of things. One, focus on and have a narrower set of issues that we're focused on, or opportunities, depending on how you want to look at it, and go deep with that North Star being an outcome and defining that outcome in a tangible way and holding ourselves and our partners accountable. So the couple things, that clear focus on the outcomes that we define up front, these focusing on big issues, but specific ones, and going deep versus many issues and not going very deep. And then these partnerships that we formed, and then finally engaging our employees in those partnerships. Because to magnify our impact, like you said, so we're not just writing checks, but we're using our skills-based volunteerism, as I used to use the term, to magnify the impact. So it's focus, it's the outcomes-oriented approach, focus on key areas, partnerships, deep partnerships with organizations that can really, we can help them, they can help us, and then. So those are the, and then engaging our employees directly involved in these partnerships.
Well, I think, that's just a perfect opportunity now for us to talk about Children's HeartLink, because all of those threads come together in this incredible relationship we've had over the years with Children's HeartLink. For folks who don't know about Children's HeartLink, you also sit on their board. Give us a little flavor of who they are and the connection between us as a company and them, and then we'll broaden this conversation and take a look at some videos and invite Jackie to share.
Yeah, so I moved to the Twin Cities 10 years ago. It was 2011, and so I've been here 10 years. I moved I was working at GE, came in and sat on the executive committee, so reporting into the CEO, and wanted to get involved in some of the community organizations, and was introduced to Children's HeartLink. And really fell in love with their mission and their approach. What I liked about Children's HeartLink is, hear me talk about this being scalable and sustainable. So it was very focused on children born with congenital heart issues, and in under-resourced countries around the world. And they have a model that is, very outcomes focused. It's also very focused on a very specific condition, because healthcare is hard, and if you try to be all things to all people, your impact, I think, is going to be limited. They're very focused, or are very focused, and it was they showed the ability to scale and make it sustainable, because the model of knowledge transfer, where they match up a hospital in the United States, like a Mayo Clinic, and pair them up with a health system in an emerging market like Vietnam or India or parts of China or Brazil. And over a course of several years, that knowledge transfer occurs. So that you're training the trainers effectively. And then that hospital becomes a trainer in that region. Plus the fact that they work with governments to show the outcomes of this work. So the governments prioritize this as in their healthcare spending. And they're getting the outcomes. The problem is significant. I skipped over that. 1 in 100 kids around the world are born with a heart defect. And many of these, no matter what no matter what your race, or if you're born in a rich country or a poor country, those are the numbers. But many of these are solvable with modern healthcare techniques, and the children will go on to lead normal lives. Some are more complicated, but many of them are eminently solvable with the right training and resources. And HeartLink has got that model down, and the results were phenomenal. And so I was blown away, and it looked really good to me. And after working with them for a couple of almost like a year, I said, "Boy, they got to meet Omar, my predecessor, who's a student of healthcare systems, and that'll be the real test." So we scheduled like an hour meeting, and Jackie and this woman Boucher, who works with Jackie's team and that leads all the programs, came, and it was supposed to be an hour meeting, and the thing lasted 3 hours. Omar kept canceling these meetings, and because he was fascinated and kept asking more and more questions. And those who know Omar, that's how he learns. And Boucher and Jackie kept having all the right answers, and from there, the marriage between Medtronic and Children's HeartLink really took on a course, an inflection point, and we've really enjoyed the partnership over the years. And we learn a lot, necessity is the mother of innovation here. And Children's HeartLink doesn't have a ton of resources, but still gets a scalable and sustainable improvement of outcome in kids around the world. And it's amazing. And so we've learned a lot as well from this partnership.
Well, it's been incredible. And I can just say, as someone who's been in the health arena for a while and in global health in more traditional ways, it's also helped us learn about how this particular condition and these types of partnerships are really part of a new generation of how we come into global health. And it's very exciting to see this all come together. Now, we've talked quite a bit about previewing a partnership. So let's just say we are announcing a new partnership today, and it's an exciting long-term and deep partnership between us and Children's HeartLink, and we're incredibly excited by it. And let's first take a look at a video, and then we'll bring Jackie in and have a deeper conversation.
90% of children born with heart disease don't have access to the care they need. Most of those children live in low and middle-income countries. Children's HeartLink works to change that by training and empowering medical teams in underserved regions of the world. The Medtronic Foundation is launching a new multi-year partnership to take that work even further, focusing on equitable access to congenital heart disease surgery, improved patient outcomes, and engaging Medtronic employees to ensure high-quality, sustainable systems of care.
We would not have had the program that we have today with our patient outcomes and training capacity if it hadn't been for our multi-year partnership with Children's HeartLink.
The Medtronic Foundation partnership aims to provide 10,000 children with quality pediatric heart surgery in Brazil, China, and India, train 10,000 health workers, including pediatric surgeons, cardiologists, and nurses, to provide congenital heart disease surgery, and leverage Medtronic employees' time and talent to reduce health disparities in access to care.
Patients like Hari, whose parents waited for 16 years for his life-saving heart surgery. We were able to help him thanks to a 3D print of his heart that showed us how to correct his heart disease.
The surgery I had makes it possible for me to go to university where I am studying technology. Because medical technology saved my life. I look forward to one day contributing to medical advances that will help others.
Together, we will strengthen global health equity and improve access to the quality care children deserve.
So it's always moving when I see that video. So I've just got to catch my breath for a second. I invite Jackie Boucher, who's the president of Children's HeartLink, to join us. I also just have to say, for anyone who really needs an example of what Earl Bakken's call to action is about giving back with your extra life, that story is inside of Hari, what he said in that video. Because of what's happened in his life and being able to have a life-saving surgery and his own commitment now to be a part of the next round of advancements, that who knows where that's going to go. And that's the extra life. And so it's just really powerful to see that all come together as a part of this conversation. So Jackie, thank you for joining us and being a part of all the work that you do and what you've led and a part of a really exciting day today with this partnership. Welcome.
Yeah, thank you, Paurvi. I'm thrilled to be here with you and Geoff talking about a topic that both of us, or all three of us in our organizations, are passionate about: equitable access to healthcare. Just to say a little more about Children's HeartLink, I know the video did probably a better job than even speaking about it, but for 50 years, Children's HeartLink has been really focused on addressing inequities for children born with heart disease. And we do this, as Geoff mentioned, by the trainer approach, really working to transform pediatric heart care in underserved parts of the world. I know Geoff mentioned, 1 in 100 children is born with a heart defect. So really put that issue in perspective. Every 5 minutes, 10 children are born with a heart defect. 9 of those 10 children won't get access to the care they deserve. Congenital heart disease is a rising contributor to infant mortality and is a leading cause of mortality from a non-communicable disease in people under 30 years of age. So it's really the leading cause of death for those ages 0 to 30 with a non-communicable disease. And I know that's part of today's World Health Day focus on inequity. Even in the United States, where we have more access to treatment, there's racial and socioeconomic disparities in infant mortality related to congenital heart disease. So it's wonderful to have this partnership to really start to address the issue in some of these underserved populations and take our train the trainer approach. And as Geoff mentioned, scale that approach. Right now, we reach about 170,000 children per year in the 5 countries where we work: Brazil, China, India, Malaysia, and Vietnam. And we hope to grow in the future to other countries. We've definitely grown our reach, but the need is great.
Well, that's impactful to know, especially given the number of countries and the opportunity for scale, not just within a country, but across, based on what we're able to do together. And Geoff, you've already outlined so much about why this partnership matters to us, just the long and rich history that we've had together and the opportunity of staying very focused and really getting to outcomes and getting to scale. But what makes us really unique, and I think many corporate foundations unique, is the combination of all of our assets, not just the financial ones, but also our employees. And so I'm just wondering, what you've seen and how you're thinking through some of those combinations of our skills. We mentioned skill-based volunteerism. Right. We've got some folks that are coming in. We know that in addition to you on this board, we have Anu Kadadi, one of our general managers, who's also on the board of Children's HeartLink, and really just galvanizing more and more, not only enthusiasm, but bringing in some of the skills of our employees. You have a lot of passion around that kind of engagement, like how to bring in engagement.
There's all kinds of areas. One you mentioned, also on the board to have with the strategy of the Children's HeartLink organization, but also we've got there's a lot of areas. Government affairs. We have large organizations, large employee base, big business in these countries, and access to government officials. We can help drive awareness and get the Children's HeartLink, narrative out there, and our evidence generation team that can help design and collect more evidence to prove the outcomes and to prove the health economics and how it's beneficial to these economies, so that it's protected in the funding as these healthcare systems prioritize where they spend their dollars. We want to make sure this is protected because 1, it works, and 2, it's good economically for them. It's a good economic investment, and you've got to be good in how you present that. I think we can help there. Technology solutions, as new technologies emerge in this space that could make these procedures more minimally invasive and easier performed. So the list goes on in terms of even communications. There's a lot of areas we can apply our resources, and then we actually have groups of as a development opportunity at Medtronic. We provide and this is a lot of this is funded out of Paurvi's organization. This organization called the Global Innovation Fellows. We take cohorts of up-and-coming Medtronic leaders, very bright, ambitious young people that, want to also give back as part of their development. We put them in dedicated teams that go into these markets and, investigate a problem or an opportunity in terms of, how can we fix something, or how can we take greater advantage of an opportunity there. And it's a so-called a surge of resources that we can apply to very specific questions or problems to help out. So there's a number of ways, and then I think the more we talk about it within Medtronic, just like when we open sourced the ventilator, I talked about, the more you talk about it, the more people come up with ideas and raise their hands, and so that's kind of how we want to do these partnerships versus just here's a check and good luck. But here's some money, and I wouldn't call it strings. It's it's like it's here's some resources too, but there has to be a mutual interest or mutual need. So that's how I see it going.
Yeah, I think it's been powerful to see, especially, that Global Innovation Fellows effort that you're referencing here. We had a cohort, and they're basically employees across the organization. They come together with different skills and different perspectives. It's actually a great way to even think about diversity and inclusion, because they are representing all different parts of the world and society, and they're coming in together with Children's HeartLink and thinking through some solutions and opportunities, and frankly, giving a different perspective on service as they grow as leaders, and integrating that into their next chapter. And during COVID, we had to grapple with a virtual way of doing that. And so, Jackie, how did that feel, and what kind of ideas came out of that when you had the innovation team with you?
Yeah, that was a fantastic opportunity for our organization to have them work with us. Obviously, our model was built on more in-person contact, and like many organizations, switching to virtual, and also being a small organization, having access to Medtronic is such a global innovator in so many areas. So helping us think about technology, helping us think about how we can educate virtually and be engaging, but achieve objectives of what we're trying to train all of these different clinicians, whether it's the surgeon, the perfusionist, the nurse. Every clinician's part of the pediatric cardiac care team. And so it really helped us think differently, help us develop more of a scalable solution, and has really helped us sustain impact during this time.
No, it's also added to creativity on their side, our side as well, and thinking about, again, one of those moments where, okay, we're in a seemingly insolvable situation. What are we going to do? And you see the best ideas come out of that. So what do you think about how deep this partnership can go, and the kind of broader impact that can happen, knowing that we're going to ultimately improve the lives of at least 10,000 kids, but also build up the capabilities of 10,000 health workers. And you've got access to a whole host of centers of excellence and health systems around the world. How do you see that in crossing disparities and also going to scale?
Sure. Yeah. This partnership is transformational for the organization. I think is going to help us scale in underserved countries that experience high disparities for children who need congenital heart surgery, but aren't able to access it. So because of this partnership, in the next 3 years, we'll be adding 5 new partner hospitals in Brazil, China, and India. And that will help us really double our impact between 2025 and 2030 as a result of this train the trainer approach that we use. I think creating more access to treatment is important. We're talking about equities today here at the Global Minnesota event. Every parent who has a child born with heart disease wants the same thing. Access to the best care possible as their child can live a long and healthy life. They want them to move, be a contributor to the world, and to have happiness. Congenital heart disease, as we mentioned earlier, as far as equity, it's the 7th leading cause of infant mortality globally. 85% of those deaths are in low and middle income countries. Access to quality pediatric cardiovascular care is a huge issue for these countries. There's also inequity, not only inequities to access to treatment, but we know there may be some inequities by gender. And I know we've talked a little bit about gender in the symposium today, inequities. The incidence of congenital heart disease is the same for boys and girls. However, there is some evidence that cultural practices may drive decisions to treat girls less than boys in some countries, but this has to be studied further. So not only are we working on partnerships with Medtronic, but one component of this partnership we're really excited about is to conduct an equity study so we can add to the data gaps in this area. I think the other part of the access gap in the countries where we work is also due to the shortage of trained health professionals and a lack of specialized training for pediatric cardiac care. And so these are major barriers to care equity in these low to middle income countries. And together we hope to address both. We'll train the local workforce by partnering with leading medical volunteer institutions that will provide some of the training to help us in the countries where we're working build regional centers of excellence so that children born with a heart defect are identified, they're treated, and they get high quality care. I think the other piece of these centers of excellence that's really exciting is that, once they achieve a center of excellence status, they're delivering a certain quality of care, but they're also training and doing research. And so we're really building local capacity. And so the lasting impact is exponential.
It'll be really interesting also to see how this combination of resources that brings the financial assets together with the talent of a company can maybe get to some of those opportunities even faster. And I know we're really open to joining on with others and ensuring that we can bring the very best collectively in collective action on this topic. I know through your work and Bistra's work, there's a lot of policy work to be done here and elevating this particular issue as a pretty strong driver of maternal and child mortality. And what do we need to do there? So it'll be an important time. We've hearkened so much about this partnership being unique, throughout this conversation. And we've all been working in different partnerships for some time. What would you say to this community that's listening today, which is representing pretty much every sector that's involved in healthcare from all parts of the world, but certainly in Minnesota? What are the things that you would say offer as guidance on unique and different types of partnership?
Oh, I'm going to take a shot at that. I mean, yeah. I talked a lot about some of the ways that we've changed our thinking, right, around the outcomes orientation, the focus, but the deeper partnerships. But one thing I'd say for companies like Medtronic, look, there's a lot we get out of this too. I mean, you got to think of the win-win here. So, like what Jackie was talking about, opening 5 new centers. I mean, that's music to my ears. I mean, 5 new partner hospitals. I mean, because that's exponential growth, right? Because then they'll treat all it's a bunch of new patients, and then they'll train other trainers to treat more patients, and then she talked about more evidence. I mean, the impact to patients here, especially in the Children's HeartLink model, is huge, and so that's enough, really. But I think there's for us just to know that and. We feel good about that, but there's more that can be had here. I mean, we can, like I said earlier, we can learn a lot, from this partnership, and we are learning, and we would like to apply to create other children heart links, if you will, in areas outside of congenital heart, problems. And we're working on setting up organizations like this in hypertension. We have one set up outside the United States, as well as hearing loss. These are other areas, clinical areas that we're in as a company, and we're learning new models of care. We're developing new technologies that are specifically designed for these under-resourced environments and these conditions, but will be applied to other areas of the company, even here in the United States. And so it is, we're getting a lot out of it, and it's not a side job. It needs to be something that has direct access to the most senior people in your company. It has to be more integrated in with what you're doing and tied to your broader company strategy, whether you're a technology company like Medtronic, or you could be a large health system. Don't treat these things like a side job that you get good PR from, or just even get feel good from. You can learn. I mean, this is strategic for us. It's tied to our mission. But it's strategic for us. And so I think of it that way, and you get a lot more out of these partnerships. I mean, what I've come to learn is you can do, in a company like Medtronic with our resources, you can do almost anything, but you can't do everything, and you got to focus. And so if you're going to partner, then partner, go big or go home. So that's what I'd say.
Well, and Jackie, so here we are. We're going to try and go big. We're definitely not going home. So what you've been partnering with a lot of folks too. I know today we are the special one, but there's been a lot of partners in the mix. What kinds of things have worked well, and what kinds of tips do you have for the future, and possibly even a call to action for us?
Sure. Yeah, no, sure. I think, today in the World Health Day, there's been some mention of sustainable development goals, and just want to say a word about that and then answer your questions for me. Yeah. That's, countries around the world signed on to the Sustainable Development Goals in 2015, which have specific targets for reducing childhood mortality and mortality from non-communicable diseases. And I think what's exciting about this partnership between Medtronic and Children's HeartLink is that we're working to address both by serving children with a non-communicable disease, which is heart disease. Mm-hmm. You know, as we've kind of seen the communicable diseases decline, congenital heart disease is constant, right? Children are born at the same rate. And so it's becoming more visible. And I think this partnership helps make it a lot more visible. I think the other exciting piece about the partnership is that it's not just about funding. You know, it's as Paurvi and Geoff, you both have talked about engaging the Medtronic employees. Is also, you know, I know it's great to hear, Geoff, that you're saying you're learning from us. We're going to learn even more, you know, from a global thought leader, Medtronic. And so I think this partnership will have a long-term impact on our program model, just like we talked about earlier with the Global Innovation Fellows and how we've had to go to remote training. But as a small organization, I think partnering and sharing knowledge, technology, data, and even talent pools, it really helps us expand our model, our reach, and our impact. And that's important if we want to address this issue of congenital heart disease. And so I think as far as innovative in the partnership, you know, I really do see that this is innovative in the sense of sharing this talent pool and sharing information. It's more of the true sense of partnership. Sometimes I think partnerships are in theory, organizations. And I think because our missions are aligned, the work is aligned, that hopefully, you know, this lasting impact of the 10,000 children impacted receiving surgery and 10,000 health professionals trained has a very big impact in years to come as a result of those outcomes that we're working to achieve.
Well, I mean, I'll also say, and I know, Geoff, I've heard you speak on this before too, there's just so much to learn from the nonprofit sector, you know, as we come into it and start thinking about these different sectors and how you need to have government plus the nonprofit sector plus the commercial and private sector to get to the solutions. You know, Geoff, if you wouldn't mind, you've shared in the past about what you've learned just yourself as someone who's come up through business and your own personal journey and in service. What kinds of things you've learned from the nonprofit sector as a sector?
Well, look, I think, you know, I've learned, and this Children's HeartLink is a good example of this, that, you know, small teams can do great things. Right. And sometimes, and this is, you know, one of anybody that's following Medtronic knows that I'm trying to go Medtronic from this $130 billion revenue company to $31 billion companies. Those $1 billion companies are still pretty big, but they're a lot smaller than 30 billion, to kind of get the teams focused on big ideas, but smaller teams working on big ideas. And I think, you know, I think that people get caught up in, you know, sometimes use, you know, I don't have resources, I don't have enough funding, and they forget the power of the idea. And just, it's woe is me, I don't have enough this, I don't have enough that. But if you focus on that idea and then communicating that idea, I do think the appropriate resources will come. I do believe that. People may say that's naive, but it's worked. You know, I've seen it work, and it's worked for me actually. And so that's one thing I've learned is if you have an idea and you have a hypothesis that you can test, that the power of the idea is big. I mean, I do believe innovation is a democratic thing. The best ideas will ultimately get resources. And it's a very democratic, but you need to be creative in how you communicate these things, and you got to have perseverance. And so that's what I see. But I do see some nonprofits get lost in the resources and lose their sense of their outcomes shift from, you know, that real impactful outcome to some other outcome along the way that isn't so impactful, and they get too wrapped up in that. And it creates problems. So I keep those outcome focused and keep those outcomes pure. Don't lose sight of the power of the idea, and those resources will come with perseverance. I believe that.
Well, that's incredible. That's actually terrific as a call to action as well. And Mark, you're back.
Yes, I couldn't miss a chance. Well, I wanted to get a chance to brag on Medtronic just a little bit. And we have a lot of viewers today in Washington or who come through Washington from the embassies and all that. And they may not know that over at the Smithsonian, there's a hall of innovation, and it has, Silicon Valley and the Boston corridor and all of that. And right next to Silicon Valley is Minnesota's Medical Alley, and it features 3 specific innovators, Earl Bakken and Dr. Lillahai and Manny, but it also features our region, and it talks about where did innovation come from and what were the elements of having the university system, having the tinkerers in their garage, having the capital. And I think that this aspect, and I'm urging all of the folks watching this that when it's safe to go see this amazing exhibit. But it's a reminder that everything comes from the spark of an idea, and then it grows, and it may or may not be able to flower or flourish. But if it can, and it does, then it creates the opportunity of, in Minnesota Medical Alley, there's 700 members, I think. So there are at least 700 companies that have really come out of that spark of innovation. And so finding this discussion really about how do we generate the energy of new ideas through the lens of Children's HeartLink making this incredible contribution around the world, I think is a very special way. I happen to devote a portion of my life to issues around heart transplants. And it's that whole area has been transformed from the times when things couldn't be fixed to the time now when they're fixed at birth. And so we have a special story within our family about this, but I'm aware of the advancements that mean that some lives can and have been saved. And I've, been a fan and follower of Children's HeartLink for a very long time. But today to hear these exciting plans is part of that notion of it inspiring us to get up the next morning. COVID can beat you down. Losing family and people dying alone. There are elements of this, but there's also how much we can help each other take tomorrow as the first day of that next birth, rebirth, that expansion, that what are we going to do with that extra treasured time?
Yeah, it's so beautifully said. And I can't help but think of Hari again, right? It's just emblematic of everything you just said. And it just makes you believe that there's so much more we should all be doing, right? They're back to, Geoff, it's not all scarcity. It's actually, there's a lot of opportunity if you just change your mindset about it. And I think all of us are saying that in different ways. That's very Minnesotan too, and being able to do that as well.
Occasionally, Medtronic hosts people or like some singers or events out in your atrium, and you have a history wall that helps just a regular citizen be able to walk through and say, oh, that happened in Minnesota. Oh, that came before that. Oh, that was just a few years ago. I mean, it's there's not a big explanation, but you are both overcome with the pride, but the amazement, but you also think, oh, how does my story fit into this? And, oh, yeah, my grandpa has one of those pacemakers. Oh, yeah, my neighbor has that heart valve, and so then somebody can see how they fit inside of that story that Medtronic has helped bring to the whole planet.
When I see it, I see that every day when I come in the office. I get inspired and kind of think, okay, what are we going to do next here? There's been a lot of innovation. What's next?
No, it's very true, and I just keep thinking again about the life that keeps getting amplified by more and more people surviving and doing more and adding more, and that timeline is just going to grow because of the next generation of innovators that are going to come through because they themselves have been touched in some way. And
it's a good time to be in this space, I would argue, because obviously the need is here like never before, and there's a better understanding around the world of the importance of equity. I think more people are tuned into this issue, and less people are ignoring it. I'll say that. And the opportunity to make a difference now is like never before because of, now I'm biased, I admit it being a technology company, but because of technology. Technology is democratizing good care. Technology will break down access barriers. Now, there's other things that are needed around that. You need the evidence, you need the government, these public-private partnerships, you need government regulations to change and things like that. But technology, there is a path to provide things like, I just got off an interview with some media on colonoscopies, and we've got a new, a pill cam, a little pill you swallow that basically gives you your diagnostic colonoscopy. This eliminates the need for, the traditional colonoscopy procedure, which I won't describe, but you know what that is. But you have anesthesia, physicians, complications, and it opens the door for some of these countries that just can't do colonoscopies that way to get colonoscopies and prevent colon cancer. I mean, so that's just one small example, but it's all enabled by technology advances, miniaturization, battery, image processing, cloud computing. All of that enables this and opens the door for hundreds of millions of people around the world to get access to this diagnostic and then treatment that they wouldn't have otherwise had. And it's just all from advancement of technology over the last 5 years. I mean, so I can give you 100 examples of these. These can be provided. You can build a children's HeartLink around a technology like that.
Mm-hmm.
And I think it is about inspiring others with directions. We have the good fortune of a 3M who thinks about physical properties of things. We have the good fortune of thinking about Medtronic, thinking about the miniaturization and the making of things so that they can be less invasive. We have all of these different components that then have made this region special, and that willingness to share. Your government affairs person in Washington, often at speeches, I see him bring a sheet of paper out, and he is a list of the innovations from other parts of the world that have been very important to the success of Medtronic. And I just am so proud to, be a Minnesotan and to have Trevor representing the appreciation that it's the sharing of ideas and incorporation into successful ways of saving and extending and improving lives. That's what makes the future bright, even in the middle of this crazy pandemic and the upside down economy. Those kinds of values, which are at the core, like you said, you haven't changed your mission since the founding, that gives us all what we need to do to get up tomorrow morning and to do the right thing again. Thank you so much for bringing this incredible story, this partnership. Jackie, it's always a thrill for me to think about all of this, and it makes me, sometimes it makes me cry, all of the things in my own life. But as a practical matter, the partnership that you have been describing is an example of that SDG number 17. There's all those 16, cut car crashes and deaths in half, that kind of thing. But then there's number 17.
Yeah,
partnership.
That's very true.
And Medtronic led the way, saying that means partnering with all of our team members and employees, partnering with our civil society and nonprofits. Partnering is the secret to the success of the vaccine and all that we've done. Thank you so much for giving us that treasure of inspiration, that example of partnership, that opportunity to get up tomorrow and do the right thing. Thank you again.
Thank you, Mark, for the opportunity as well. And
Thanks, Mark. Well said.
Bye now.
Thank you.
Bye-bye.
Thank you, Paurvi.
Thank you.
All right.
Thanks, Geoff. Thanks, Paurvi.